Hello, my name's Betty. I want to thank you for joining me for another episode of Mental Health Matters. Today we're going to discuss bipolar disorder, what it is, some of the symptoms, and some of the treatments. Bipolar disorder, it's also called manic depression. It's a disorder associated with episodes of mood swings, ranging from depressive lows to manic highs. The exact cause of bipolar disorder, it isn't known, but a combination of genetics, environments, and altered brain structure and chemistry, these all are believed to play a part in the manic episodes. Some of the episodes may include symptoms such as high energy, reduced need for sleep, loss of touch with reality. Depressive episodes may include symptoms such as low energy, low motivation, and loss of interest in daily activities. Mood episodes, they can last from days to months at a time, and they may also be associated with suicidal thoughts. Treatment, it's usually lifelong and often involves a combination of medications and psychotherapy. Although bipolar disorder is a lifelong condition, you can manage the mood swings and other symptoms by following a treatment plan. There are several types of bipolar-related disorders. Bipolar 1 disorder, it's when you've had at least one manic episode that may come before or after a hypomanic or major depressive episode. In some cases, mania, it may cause a break from reality. This is called psychosis. Bipolar 2, it's when you've had at least one major depressive episode and at least one hypomanic episode, but you've never had a manic episode. Cyclothymia is when you've had at least 2 years or 1 year in children and teenagers of many periods of hypomania symptoms and periods of depressive symptoms. These symptoms are less severe than major depression. Other types of bipolar-related disorders, they are caused by certain drugs or alcohol or due to a medical condition such as Cushing's disease, multiple sclerosis, or a stroke. These types may include manic or hypomanic. Hypomanic is less extreme than manic, and it also may include depression. Symptoms can cause changes in your mood and behavior, and it can't be predicted. This can lead to a lot of distress and cause you to have a hard time in life. Bipolar 2 disorder, it's not a milder form of bipolar 1 disorder. It is a separate diagnosis. While the manic episodes of bipolar 1 disorder can be severe and dangerous, people with bipolar 2 disorder can be depressed for longer periods of time. Bipolar can start at any age, but usually it's diagnosed in the teenage years or early 20s. Symptoms can differ from person to person, and symptoms may vary over time. Manic and hypomanic are different, but they have the same symptoms. Mania is more severe than hypomania. It comes from noticeable problems. It causes more noticeable problems at work, school, and with social activities, as well as getting along with others. Mania also may cause a break from reality, known as psychosis. You may need to stay in a hospital for treatment. Manic and hypomanic episodes include 3 or more of the following symptoms: being much more active, energetic, or agitated than usual, feeling a distorted sense of well-being or too self-confident, needing much less sleep than usual, being unusually talkative and talking too fast, having racing thoughts or jumping quickly from one topic to another, being easily distracted, making poor decisions. For example, you may go on buying sprees, or you may take sexual risks, or you make foolish investments. A major depressive episode includes symptoms that are severe enough to cause you to have a hard time doing day-to-day activities. These activities include going to school or work, as well as taking part in social activities and getting along with others. An episode includes 5 or more of these symptoms. Having a depressed mood. You may feel sad, empty, hopeless, or fearful. Children and teens who are depressed, they can seem irritable, angry, hostile. Having a marked loss of interest or feeling no pleasure at all in any activities. Losing a lot of weight when not dieting, or overeating and gaining weight. When children don't gain weight as expected, this can be a sign of depression. Sleeping too little or too much, feeling restless or acting slower than usual, being very tired or losing energy, feeling worthless, feeling too guilty, or feeling guilty when it's not necessary, having a hard time thinking or concentrating, or not being able to make decisions, thinking about planning or attempting suicide. Symptoms of bipolar disorder including depressive episodes. They may include other features such as anxious distress, when you're feeling symptoms of anxiety and fear that you're losing control. Melancholy, when you feel very sad and have a deep loss of pleasure. Psychosis, when your thoughts or emotions disconnect from reality. The timing of symptoms may be described as mixed. When you have symptoms of depression and mania or hypomania at the same time. Rapid cycling, when you have 4 mood episodes in the past where you switch between mania and hypomania and major depression. Also, bipolar symptoms, they may happen when you're pregnant, or symptoms can change with the seasons. Symptoms of bipolar disorder, they can be hard to identify in children and teens. It's often hard to tell whether these symptoms are the usual ups and downs or due to stress or trauma, or if they are signs of a mental health problem other than bipolar disorder. Children and teens, they may have distinct major depressive or manic or hypomanic episodes, but the pattern can be very different than adults with the same disorder. Moods can start fast during episodes. Some children may have periods without mood swings between the episodes. The most noticeable signs of bipolar disorder in children and teenagers may be severe mood swings that aren't like their usual mood swings. Despite their mood extremes, people with bipolar disorders often don't know how much being emotionally unstable disrupts their lives and the lives of their loved ones. As a result, they don't get the treatment that they need. If you're like some people with bipolar disorder, you may enjoy the feelings of euphoria and the cycles of being more productive. But an emotional crash always follows this euphoria. This crash can leave you depressed and worn out. It can cause you to have problems getting along with others. It also could leave you in financial or legal trouble. If you have any symptoms of depression or mania, see your health care or mental health professional. Bipolar disorder, it doesn't get better on its own. A mental health professional with experience in bipolar disorder can help you get your symptoms under control. Thoughts about suicide and acting on these thoughts are common for people with bipolar disorder. If you're thinking about hurting yourself, or if you have a loved one who is in danger of suicide, get help. You can let a family member know or friend. Contact the suicide hotline or call 911 or your local emergency number or go to the emergency room. In the U.S., you can call or text 988 to the suicide hotline. It's available 24 hours a day, 7 days a week, and it's free and confidential. While it's not known what causes the bipolar disorder, several factors may be involved. Biological differences, for instance. People with bipolar disorder appear to have physical changes in their brains. The importance of these changes is still uncertain, but more research may help identify why these changes happen. Genetics is another one. Bipolar disorder, it's more common in people who have a first-degree relative, such as a sibling or parent with the condition. Researchers are trying to find genes that may cause bipolar disorder. Some of the risk factors that may raise the risk of getting bipolar disorder or cause the first episode include having a first-degree relative, such as a parent or sibling with bipolar disorder, periods of high stress, such as the death of a loved one or another traumatic event, drug or alcohol misuse. If left untreated, bipolar disorder can lead to serious problems that affect every area of your life, including problems related to drug or alcohol misuse. Suicide or suicidal thoughts, legal or financial problems, trouble getting along with others, poor work or school performance. Sometimes what seems to be bipolar disorder might really be another disorder, or the symptoms of bipolar might overlap with other disorders, and you also may have another health problem that needs to be treated along with the bipolar disorder. Some conditions can make the bipolar disorder symptoms worse or make treatment less successful. Some of the examples are anxiety disorders, eating disorders, attention deficit disorders, also known as ADHD, post-traumatic stress disorder, also known as PTSD, alcohol or drug misuse, borderline personality traits or disorders, physical health problems such as heart disease, thyroid issues, headaches, or obesity. To find out if you have a bipolar disorder, your evaluation may include a physical exam and blood test to find out if there's any medical problems that may be causing your symptoms. A mental health assessment may be carried out by your healthcare professional. They may refer you to a psychiatrist who will talk to you about your thoughts, feelings, and behavior patterns. You may also answer a series of questions. With your permission, family and friends may be asked to provide information about your symptoms. You may be asked to keep a daily record of your moods, your sleep patterns, or other factors that could help make the right diagnosis and get you the right treatment. Although children and teenagers with bipolar disorder, they are diagnosed on the same scale that we use for adults, the symptoms in children and teens, they may not fit neatly into a diagnostic category. Also, children who have bipolar disorder, they're often diagnosed with other mental health disorders, such as ADHD or behavioral problems. This can complicate a diagnosis. These children may need to see a child psychiatrist with experience in bipolar disorder. Treatment is best guided by a medical doctor who diagnoses and treats mental health conditions, who is skilled in treating bipolar-related disorders. Your care team also may include a psychologist, social worker, or a psychiatric nurse. Bipolar disorder, it's a lifelong condition with treatment directed to manage the symptoms. Depending on your needs, treatment may include medicines. Often you'll need to start taking medicines right away to balance your moods. Ongoing treatment. You need to take your medicine for the rest of your life, even when you feel better. If you don't keep taking your medicine, your symptoms could come back, or minor mood changes could turn into full-blown mania or depression. Intensive outpatient programs, or a program involving a partial stay in a hospital. These programs provide intensive support and counseling that last a few hours a day for a few weeks to help you get the symptoms under control. Treatment for alcohol or drug misuse. If you have problems with alcohol or drugs, you'll also need treatment for this misuse. Without this treatment, it can be very hard to manage your bipolar disorder. Your healthcare professional, they may recommend that you stay in the hospital if you're behaving dangerously or thinking about suicide, or if you become detached from reality. Getting mental health treatment at a hospital can keep you calm and safe and can stabilize your mood. This is true whether you're having a manic or major depressive episode. The main treatments for bipolar disorder include medicines and talk therapy, also known as psychotherapy, to control symptoms. Treatment also may include education and support groups. Several medicines are used to treat bipolar disorders. The types and doses of medicines prescribed are based on your symptoms. Usually, you'll need a mood stabilizer or an antipsychotic medicine that functions as a mood stabilizer. Medicines may include mood stabilizers. Mood stabilizing medicines, they help control the manic or hypomanic episodes. They also may help depressive bouts. Examples include lithium, valproic acid, also known as Depakote. These are just a few of the medications. Antipsychotic medicines, they have mood stabilizing properties, and they have been approved by the U.S. Food and Drug Administration for manic and hypomanic episodes or for maintenance treatment. Antipsychotics may be used by themselves or with mood stabilizers. Examples of antipsychotic drugs are olanzapine, also known as Zyprexa, risperidone, Seroquel, and Abilify. These are just a few of the many drugs that have been approved to treat bipolar disorder. Antidepressants sometimes can cause a manic or hypomanic episode. Antidepressants should be prescribed along with a mood stabilizer or an antipsychotic medication. The medicine Symbox combines the antipsychotic drug olanzapine with the antidepressant fluoxetine. This is approved to treat bipolar depression. Benzodiazepines, they may ease anxiety and they may make you sleep better, but they're usually used only on a short-term basis because they can be misused when taken for a long time. Finding the right medicine for you likely will take some trial and error. If one doesn't work well for you, there may be others to try. Sometimes 2 or 3 medicines are used at the same time. This process requires patience, as some medicines requires weeks to months to take full effect. Periodic routine blood monitoring may be needed for certain medicines. Generally, your healthcare professional changes one medicine at a time. This is done to find out which medicines make your symptoms better with the least side effects. You may have side effects with medicines. Some side effects may get better as your healthcare professional adjusts the doses and your body gets used to the medicine. Talk to your healthcare professional or mental health professional to find a medicine that can be effective and has minimal side effects. Don't make changes or stop any of your medicines until you talk to a mental health professional. They can cause you to have withdrawals or can cause your symptoms to return or get worse. A few medicines for the bipolar disorder have been linked directly to birth defects. These medicines can pass through the breast milk to the baby. Every medicine is different, so you should talk with your prescriber before taking them. If you are pregnant or become pregnant, talk to your healthcare provider before taking the medication. Some of these medicines have a warning on them. Psychotherapy is also called talk therapy. It's part of the bipolar treatment. It can be provided on an individual, family, or group settings. There are several types of therapies that may help. Interpersonal and social rhythm therapy. They focus on stabilizing your daily rhythms, including sleeping, waking, eating. A consistent routine helps manage your moods. And a daily routine for sleep, diet, and exercise may help people with bipolar disorder. Cognitive behavior therapy is therapy that focuses on identifying unhealthy negative beliefs and behaviors and replacing them with healthy positive beliefs and behaviors. CBT can help find what triggers your bipolar episodes. You also learn effective ways to manage stress and cope with upsetting situations. Psychoeducation is another one. It's learning about bipolar disorder, and it can help you and your loved one know more about the condition and know what's going on and can get you the help that best supports your issues. Make a plan to stop the symptoms from returning and stick with the treatment. Family support and communication can help you stay with your treatment plan. It also can help you and your loved ones see and manage warning signs or mood swings. Depending on your needs, your healthcare professional may add other treatments to your therapy. If you don't get better with medicines or can't take antidepressants for health reasons, there are other treatments available. Ask your healthcare provider. Ketamine is also a drug that's been studied for the treatment of bipolar disorder. There's limited research on it. It can have side effects. Right now, it's only trial, but it has shown some promising effects. Children and teenagers, teachers and counselors can also be a major support system, and they can help you get the treatment you need. There is no way to prevent bipolar disorder, but getting treatment as soon as you notice a mental health condition can keep it from getting worse. If you've been diagnosed with bipolar disorder, there are ways to manage the symptoms and stop them from becoming full-blown episodes of mania or depression. Pay attention to the warning signs. Talk with your care team about the symptoms. This all can be very effective. Get enough sleep. Stay away from drugs and alcohol. And take your medicine as prescribed. And if you are having any problems, talk to your healthcare provider. But if you are having any suicidal thoughts, get help immediately. Text 988 to the Suicide Lifeline or 911. Thank you again for joining me for this episode of Mental Health Matters.